Yes, good morning, ladies and gentlemen. Good morning, Mr. Chairman. First of all, I want to thank Professor Cittadini. He will come, I think, for inviting me to this interesting symposium. And it's nice to meet so many pioneers in this area. So the topic of my talk is, after a long fight, a new law for reproductive medicine. In Germany, we have since 1990 a very strict law in Germany for reproductive medicine. I will come back to this point, and as you all know, progress was obtained and could be obtained very fast in this area, and with this law it was impossible to follow all these progresses. So there is a committee in Germany, and we were asked by the Ministry of Health, who is responsible for this new law, and this committee of the so-called Leopoldina, it's a National Academy of Science, was asked to create a new law, and I will discuss this with you, and I hope it will come hopefully next year, maybe this year. So does not work. Complicated machine. Okay. This is Lübeck. It's a fantastic city in northern Germany, very old university town, and I live there since many years. It's not as old as Palermo, but it's very nice. And it's important, this law, because we can help many patients with this. In Germany, there are, and also in other countries, about 15 to 20% of all couples with infertility problems, which means more than 1 million patients in Germany, and therefore it is important to do something for this big group of patients. You know this picture. Simon showed it yesterday, and I think you are familiar with this photo. Louis Brown and Bob Edwards and Patrick Steptoe reporting on a press conference about this first delivery, which is now 40 years ago. And here you see this Louis Brown. As you can see, the culture medium they used was very good. And she's exactly 40 years now in July. And as you all know, Bob Edwards influenced many things in the science, and also he was the father of ESHRE, of the European Society of Human Reproduction and Embryology. And here are some milestones which he influenced with his knowledge, with the journals and so on, like the secretion, synthesis and mechanism of GnRH agonists and cryopreservation, recombinant gonadotrophins, pre-implantation genetic diagnosis, and the GnRH antagonist, embryonic stem cells, single embryo transfer, and vitrification. So there are many developments in reproductive medicine which were influenced by him, and we have to be very thankful to him. So this is an old slide from '96 from Joshua Dor from Israel, and he could report that today more than 60% of the infertility causes, like ovarian failure or tubal or male infertility, can be treated successfully, which means we can reach a pregnancy and hopefully a delivery. So we can do a lot, but we have to do more. So up to 2015, more than 7 million babies were born after in vitro fertilization, which is a birth rate, and this is the most important figure for me, the birth rate of 26% worldwide. And if you compare this with natural conception, which still is practiced, and we have a pregnancy and birth rate of 24%. So we are nearly as good as nature, but of course it's more complicated. And as you can see, in Germany, we have a birth rate of 21%, which is worse than in the rest of the world. I think it doesn't mean that we are not very experienced in Germany, but the law prohibits us to do everything which is possible and helpful for the patient. These are figures from ESHRE, and as you can see, in Europe, there are about 550,000 cases of IVF, ICSI, and other procedures. So it's a lot, and more is done with ICSI than with IVF, which we think is doubtful. So in Germany, we have a problem. One problem is the high rate of multiple pregnancies. As you can see here from the German IVF registry, the twin rate and also the triplet rate is very high, twin rate of 33% and the triplet rate of 6%. This is due to the old embryo protection law, which I come back in a minute. Of course, sometimes twins are nice. These are the Keys brothers, and they created an institute in Chicago for research on twin and multiple pregnancies. And they look like twins, I think. Yeah? But there are many problems with multiple pregnancies. There are pregnancy-related diseases, and prematurity is a big problem because these twins and triplets are born too early, and therefore there is an increase in neonatal morbidity and mortality. So it's a real disaster, and we have to do everything to avoid a multiple pregnancy. And on the other hand, we want to improve the pregnancy and live birth rate. This can be done with a single selected embryo transfer. This was shown. And as you can see here, only by morphological criteria, it is possible to select an embryo with a high chance of implantation. On the left side, this embryo for cell stage has a chance of more than 30%, and the irregular embryo on the right side has a low chance of about less than 5%. So it's relatively easy without PGS to select an embryo with the best implantation possibility, and this was first shown by Garris, and he could show and pregnancy rate of more than 40% with an elective single embryo transfer and only 1% twins. If you transfer two selected embryos, you cannot improve very much the pregnancy rate, but the multiple pregnancy rate with 32% of twins. In Germany, we have, since 1990, that means nearly 30 years, a strict embryo protection law, and this is the most important part of this law. We are allowed not to transfer more than 3 embryos, which I think, of course, is very good. But on the other hand, we have to transfer every embryo which is fertilized and cultured in the test tube, which means we are not allowed to freeze embryos. Every embryo has to come back to the patient in the same cycle. We know, for example, from Sweden, that it is much better to do only a single embryo transfer. And as you can see, this number increased over the years in Sweden. And however, the pregnancy rate and birth rate was the same, also when you reduce the number of embryos. But of course, the number of multiple pregnancies was reduced a lot. Here you see the difference between Sweden and Germany, and this is due to this embryo protection, to the old embryo protection law, which shows that in Germany, in about 80% of the cases, more than 2 embryos or 2 embryos were transferred. However, in Sweden, in most of the cases, only 1 embryo. And this shows, in comparison to Sweden and Germany, that the pregnancy rate, although they transfer only one embryo, is much better than in Germany, with 26%. However, we have to transfer every embryo, and of course, sometimes the quality is not good enough for implantation, but we have a high rate of twin and triplet pregnancies, as you can see, 20% at that time. So the question is, which procedure can we use to select an embryo? We can use a blastocyst culture, which is allowed in Germany, but however, we only can culture 3 embryos, and from these 3 embryos, we have to transfer a blastocyst, or sometimes 3 blastocysts. And the question is PGS helpful to select an embryo? Here you see the blastocyst stage transfer, and this shows, this meta-analysis shows that there is a small advantage, a better pregnancy and birth rate with the transfer of a blastocyst. And the question is PGS helpful? PGD, you know, the pre-implantation genetic diagnosis, which is also allowed now in Germany after a long fight. And however, the circumstances in which we can do this PGD is very difficult. Every case has to be decided by an ethical committee, and it is very expensive. Also, the consultation of this ethical committee has to be paid by the patient, which is about 1,000 to 3,000 euro per case, every case. And there are committees over Germany, and they have to decide every case. And there is a pre-implantation genetic screening, which means that we look for an aneuploidy of the embryos and try to decrease the abortion rate and to increase the birth rate. This was the idea, of course, behind PGS. You know PGD, we have the oocyte, and this oocyte is fertilized, and then we take a biopsy with 2 blastomeres and do the genetic examination. However, with PGS, we have this old meta-analysis of Mastenbrooks from 2008, and surprisingly, this showed a decreased birth rate after PGS and a better result in the control group, which means at that time with this meta-analysis and with these procedures which were done, this procedure that is not helpful to improve the pregnancy and birth rate. And this was also said by a statement of the ASRM, and they could state that it is not helpful to and not to support the use of PGS to improve the live birth rate in patients with advanced maternal age and implantation failure, recurrent pregnancy loss, and other problems. So also ESHRE has done this kind of statement, and we are waiting for a better meta-analysis, which for my knowledge is not done up to now. Just to mention it, we have the cryopreservation. In Germany, it's allowed only to cryopreserve oocytes and oocytes in the prenuclear stage. And of course, with the vitrification method, these results are improved now. This is from the German IVF registry. We have a pregnancy rate per embryo cryotransfer of 15%. With the vitrification here, you can see Professor Alassani from our lab, we could improve these results, and the pregnancy rate by vitrification is now about 34% in our lab, which is the same as with fresh embryos. So this is the old embryo protection law, And as you can see, what is forbidden, it's not allowed to fertilize more than 3 oocytes and to culture more than 3 embryos. PGD is allowed, but under difficult circumstances. Oocyte donation was not allowed, surrogate motherhood not allowed, and also the other things like embryo research is not allowed in Germany. This is the old embryo protection law, nearly 30 years old, and we have the problems which I showed to you with high rate of multiple pregnancy rate. We would like to do the single embryo transfer, and also PGD. We have still our problems, although it is allowed. And oocyte donation, embryo freezing is not allowed in Germany. So this is a so-called Leopoldina, the National Academy of Science, one of the oldest academies in Germany since 1600. And in this academy, committee was created, and you can see the names here of specialists in reproductive medicine and lawyers, geneticists, and ethicists. So we had a very good committee, and we worked for 4 years in this committee to create this so-called new law of reproductive medicine, which we prepared for the government, and now have a meeting in July with the government to discuss this law, which is now ready. And this is this new law which we create. Of course, a law in reproductive medicine is always a compromise. However, we are allowed, this is a proposal, to fertilize as many oocytes as you need for a successful treatment, which can be 5 or 7. And we want to transfer only 1 selected embryo to improve the birth rate and to reduce, of course, the multiple pregnancy rate. It is not allowed to transfer more than 3 embryos, and cryopreservation is allowed of embryos, because if you want to select 1 embryo, you have to freeze the other ones. And the question always is what to do with the other embryos. We think that they can be destroyed if they are not wanted by the parents, or it can be allowed to adopt these embryos. Surrogate motherhood is not allowed. PGD, I mentioned it already, is allowed, but the circumstances are not very positive for the patient. Sperm donation was allowed already, but oocyte donation not. So we want to allow this oocyte donation under strict criteria in licensed centers. And a law always is very strict and not very mobile. We want a committee like in the UK, kind of a human fertilization embryology authority, which can react on new developments and decide if these new procedures are helpful for our patients and, of course, for our patients. So the last slide, the future of reproductive medicine. We need a new embryo protection law. I think it will be impossible to have a European law. And we have to improve the pregnancy rate by the elective single embryo transfer. This was shown in many countries, in Sweden and also in Belgium. And we have to avoid the multiple pregnancies. Vitrification is a new procedure which is very helpful, also in the freezing of oocytes. In vitro maturation, still not decided if it's really helpful. And the aim of infertility treatment should be simple, safe, comfortable, successful, and the most difficult part, cheap. Thank you very much.
Now,